Hello everyone. Today we will be concluding the lecture on sterilization and disinfection. I have put a series of lecture on sterilization and disinfection, and in this series it is the third and the last lecture, or video you can say. In the first lecture or video, I have introduced sterilization and disinfection and has defined it. Those who are interested can go and see it. It's on the tube. Then in the second lecture, I have put methods of sterilization and disinfection, where I have defined different methods, physical as well as chemical. And today is the last concluding lecture, and that is on disinfectants and their role. So disinfection, I have already defined as the removal of pathogenic microorganisms, usually in their vegetative forms, rarely in spore form too. And it can be achieved by physical or chemical method. Physical is when we are applying something and separating the microorganisms from the rest of the material. And this is usually by using filters. If you want to know the details of filtration and the type of filters, pore size, you can go to my video on the methods of sterilization. That is the second video. Here we will concentrate on disinfectants and disinfection and the types of disinfectants that can be used. So we will concentrate on chemical that are used as that are used for disinfection, and such chemicals which are used for disinfections are called disinfectants. So different disinfectants have different target ranges, and no single can kill all kind of organisms. So for different microorganisms, we need different disinfectants. Those which can remove all kind of microorganisms in their vegetative or spore form, or vegetative and spore form, those are called sterilants. We don't call them disinfectants. So disinfectants have their own limitations, and disinfectants has been classified according to which is on the basis of consistency, their consistency, on the basis of the spectrum of activity, and on the basis of the mechanism of action, how they operate and remove microorganisms. These are the three bases on which disinfectants has been classified. So coming to consistency, we usually disinfectants have to spread, they have to be wettable, so they can be in liquid or they can be in gaseous state. So they can be in liquid state or gaseous state. Example of liquid state is alcohols and phenols, and example of gaseous state are formaldehyde vapor and ethylene oxide. Now, based on the spectrum of activity, spectrum means what kind of microorganisms they can kill. So, what kind and number, how many how many types of microorganisms they can remove. That is the spectrum. If they can remove maximum number of microorganisms, they are high level. Intermediate is in between, and low is the one which can remove less number of microorganisms. These are the three spectrum of disinfectants. High level examples are 2.4% less than or equal to glutaldehyde based formulations. Then I have mentioned several names. I hope you can read my slide, and if it's not readable, I will be very happy if you can write in the comment box so that I can improve. So I have mentioned different names. You can go through the names of high level disinfectants. These high level disinfectants are used on critical items. What are those critical items? Critical items are the ones which have to be used in surgery, or they are cardiac or urinary catheters, implants, and ultrasound probes, which we cannot sterilize by physical method, though we need it to be totally sterilized. But because of their material or because of their use, we cannot keep them under heat conditions, either in direct nor in direct heating condition, nor in moist heat condition. They are made up of such material, but we are using them, and in they are entering in sterile tissue or vascular system. So since they are entering in the part where which is totally sterile, and we need these items like some surgical instruments or catheters, these has to be inserted inside the sterile tissue, and we need them to be as we need the number of microorganisms as minimum as possible. So for that we use high level disinfectants, and I have mentioned the name of the disinfectants too. Coming to intermediate level, these are the few examples of intermediate level like phenols. These are the examples. You can go through, read. They are the simple chemical name. You can read. These are the ones which are used as intermediate level disinfectants. And these are the ones which come in contact with mucous membrane or non-intact skin. Though mucous membrane itself has a capacity, first lines of defense cell which provides a bit of immunity to it, and non-intact skin too is having a line of defense in itself. It's not totally sterile, so we can use low level intermediate, no, not low level but intermediate level disinfectants on this. So intermediate level disinfectants are used in the place where you are inserting it under the mucous membrane or non-intact skin, like respiratory therapy instruments, anesthesia instruments, equipments, endoscopes, laryngoscope blades. These are the names: cytoscopes, diaphragm fitting rings. These are the things, equipments, instruments which need to be cleaned or and disinfected. Cleaning is just washing it out, and disinfection is removing of microorganisms, maximum that we can do. So in this case, we can use, for these particular instruments, we can use intermediate level, since they are, these places where they will be used are not totally 100% sterile. When we are inserting instruments in totally 100% sterile conditions, sterile tissue, we use high level disinfectants. Low level disinfectants are isopropyl alcohol, ethyl alcohol, and they are the ones which are used, which come in contact with intact skin and no mucous membrane, non-mucous membrane surfaces. So they are divided into two types. One is non-critical patient care items. They like the bed pens, blood pressure cuffs we use on different patients, and they can be cleaned by low level disinfectants. And similar is another, we are dividing non-critical items into two groups: non-critical patient care items and non-critical environmental surfaces. Like the hospitals should keep on being disinfected by these low level disinfectants, since they are economical also, like bed rails, food utensils, patient furniture, floor should be disinfected daily, on the daily basis. And where patient number is more, they should be cleaned between the intervals of 12 hours also. So these low level disinfectants are used in case of non-critical items. Last classification on which disinfectants can be classified is on the mechanism of action, where they are acting. Like they are acting on the cell membrane of microorganisms. Once the cell membrane is damaged, then microorganisms will be killed. So alcohol and some kind of detergents are the ones which are acting on the cell membrane of microorganisms, and thus resulting in microbicidal activity. Then others are the denaturation of, they are causing denaturation of cellular proteins. Alcohols and phenols cause denaturation of cellular proteins of microorganisms, so they become microbicidal. Oxidation of essential sulfur hydryl groups of enzymes, so they are disturbing the enzymes of microorganisms, thus resulting in microbicidal activity. Examples are hydrogen peroxide and halogens. Alkylation of amino, carboxyl, hydroxyl groups. This is caused by ethylene oxide and aldehydes, and thus resulting in removal of microorganisms. And damage to nucleic acid. Once the nucleic acid is damaged, then total stop. There will be no nucleic acid damage. That means it can cause mutagenesis also, and thus it can result in removal of microorganisms, which is done by ethylene oxide and aldehyde. And ethylene oxides and aldehydes are the high level. Ethylene, basically ethylene oxide is sterilant, while aldehydes are high level disinfectants. Now, what will be an ideal antiseptic or disinfectant will be having? It will be having wide spectrum of activity. It can destroy it can destroy microbes, microorganisms, and time is very important in a practical period of time, because we need these instruments as like probes and all needed every time. There we need the probe all the time, the instrument, and for next patient we need a disinfectant probe, disinfected probe. So this disinfectant should be of such use that it should destroy the microorganisms in a practical period of time, so that we can use it all the time. And it should be active in the presence of organic matter. That means it should not react with organic matter and lose its character. It should be effective in contact and wettable, active in any pH and be stable. It should have long shelf life and should be speedy time. We have already talked about. It should have high penetrating power, and it should be non-toxic, non-allergic, non-irritative, and non-corrosive. This is some properties which ideal disinfectant should have. So this finishes this lecture on disinfectant and its uses. I will be very happy if you can comment and tell me how you're finding my lectures. Thank you so much.